Hello, everyone. Welcome to another interesting episode of the Anti-Francis podcast. It's a new week, yeah, and I hope that you had a nice weekend. And today being Monday, I hope that it sets a good tone for your week. How has been your day? Okay, today I'll be talking about a very important topic. Okay, I can't even stress how important it is, and I figure that it is high time somebody talked about it because people seem to not want to pay attention to it, or maybe they're just ignoring it. And it is one that has a far reaching effect on a lot of things in our lives. Okay, what I'm talking about essentially is sexually transmitted infections. Okay, they are also called sexually transmitted diseases, STIs or STDs for short. Okay, these infections are no joke, guys. They are far reaching, like I said, and they affect a lot of people, majorly because of that sexual factor. You know, it is something that people cannot do without. And once you're an adult, at least in modern societies, it is something that people engage in. And a lot of people do not even know the consequences of what they are doing. You know, they some people engage in indiscriminate sexual activities and have multiple sexual partners and a lot of this. And it affects people, not just the person, but even others around them. Okay. And this topic is very important at this time because it's like people don't even care anymore. People just do things like they want. People are not as responsible as they used to be. So, safe sexual practices are dwindling, they are diminishing in the society, and this is endangering a lot of lives. According to WHO, more than 1 million curable sexually transmitted infections are acquired every single day worldwide in people between age 15 to 49 years old, majority of which are asymptomatic. This complicates the issue because, well, if some people have symptoms, maybe they would be more careful. But a lot of these diseases are asymptomatic at first. It is when they have become complicated that the symptoms begin to show. In 2020 alone, there were an estimated 374 million new infections in people of this same age range, that is 15 to 49, with one of four curable STIs, the most common ones being chlamydia, gonorrhea, syphilis, and trichomoniasis. Okay. An estimated 8 million adults between 15 and 49 years were infected with syphilis alone in 2022. And listen to this, more than 500 million people between that same age range are estimated to have a genital infection with herpes simplex virus. Human papilloma virus is another infection which is associated with cervical cancer. Human papilloma virus infection is associated with over 311,000 cervical cancer deaths each year. You know, I've talked about cervical cancer on this show a while back. And 1.1 million pregnant women are estimated to be infected with syphilis in 2022, resulting in over 390,000 adverse birth outcomes. You see, STIs have a direct impact on sexual and reproductive health through stigmatization, infertility, cancers, pregnancy complications, and even increased risk of HIV. And do not forget that people with HIV now, they are even at higher risk because of the cut of funding for the medications. So we should not even have newer infections. We should be looking at how to eradicate the infections that are already known. Okay. Another problem with STIs is drug resistance, which is a major threat now to reducing the burden of STIs worldwide. All of these reasons and stats that I've listed, they are enough for us to examine what STIs are, the causes, the prevention, the consequences and complications, and how we can try as much as possible to reduce the incidences of STIs. Okay, which is why I'm talking about it today. So, without further ado, let's get right into it. What are STIs or STDs, as a lot of people call them? They are simply diseases that are transmitted through sexual contact. I say sexual contact because, well, when we say sexual intercourse, a lot of people already have their mind on penetrative sex, maybe vaginal sex or oral sex or anal sex. Okay. But sexual contact is more than that. It could be through skin contact, or through kissing, mixture of salivas. All of those are part of how sexually transmitted infections are actually contracted, that is transmitted from one person to another. And these infections are caused by various organisms. There are many different organisms that are responsible for these infections. The causative organisms are either bacteria, parasites, viruses, majorly, okay? More than 30 different microorganisms are known to be transmitted through sexual contact, okay? Some STIs can also be transmitted from mother to child during pregnancy, childbirth, and breastfeeding, okay? There are eight major pathogens that are linked to the greatest incidence of STIs. Four of them are currently curable, while the other four are viral infections, which are not curable. Okay. The four that are curable are syphilis, gonorrhea, chlamydia, trichomoniasis. While the other four, they are viral infections, which are not really curable. Okay. Some can be managed, while others, as of now, do not have any known cure. There's hepatitis B, herpes simplex virus, there's HIV, and there's human papilloma virus. The human papilloma virus is the one that results to cervical cancer, like I said earlier. Okay. Also, imagine outbreaks of new infections can be acquired by sexual contact, and some of these are mpox, Shigella, Neisseria meningitidis, Ebola, and even Zika. So these newer infections or newly discovered infections have also been discovered to be transmittable through sexual contact. Okay. Some neglected STIs have also been found to be reimagined, like the lymphogranuloma venereum. These are already causing challenges in providing adequate services for STI preventions and control. So, like we always say, it's better to prevent these things because control may not be very easy. And the thing with these STIs is that they can reoccur, okay? And with the issue of antimicrobial resistance that's been on the rise, it is very possible that these um, sexually transmitted infections will reoccur or will not clear totally and lead to complications, okay? So, STIs can have serious consequences beyond the immediate impact of the infection itself. For example, STIs like herpes, gonorrhea, and syphilis can increase the risk of HIV acquisition. Mother to child transmission of STI can result in stillbirth, neonatal death, low birth weight, prematurity, sepsis, neonatal conjunctivitis, and even congenital deformities. Human papilloma virus infection causes cervical cancer and even other types of cancer, like I said. Hepatitis B resulted in over 1 million deaths in 2022, mostly from cirrhosis and hepatocellular carcinoma. That's cancer of the liver and death of liver cells. Okay. Then STIs like gonorrhea and chlamydia, they are major causes of pelvic inflammatory disease and infertility in women. For the male, it could lead to swollen or sore testicles, infections in the urethra and the prostate. It could also lead to infertility in males. Okay. Imagine all these complications. And these are highly transmittable. They can be transmitted from one person to another in a high rate. Okay. So there is need to understand these diseases, like I said, know how to prevent them, and peradventure you actually have them, know the appropriate quarters to go for treatment. Okay, most of them are treated with antimicrobials, and like I said, antimicrobial resistance is an issue right now, so you must know how to take care of them once and for all, which is why treatment of sexual partners is important. You cannot just go and get medication for yourself if you discover that you have these diseases, and neglect your partner, which is why we emphasize having one sexual partner, okay, and not multiple partners, because you may not know who you got it from or who you're transferring it to. And those ones will in turn transmit to other people. So once you have one sexual partner, you treat yourself, you treat your partner, and that is the end of it. I've mentioned common sexually transmitted infection, about eight of them, but there are others like crabs, that is pubic lice. Okay, there is cancroid, there is molluscum contagiosum, okay, which is a viral infection. There is scabies, which is a parasitic infection caused by a mite, Sarcoptes scabiei. There is genital warts, there is vaginitis, as well as many others that may not be so easy to pronounce, okay? Or at least you know the common ones now. So, how do you know that you have sexually transmitted infections? If you're sexually active, you are prone, especially if you are not sure that your partner is faithful, okay? And the symptoms usually appear around the genital region or sometimes on the skin, okay? They include bumps, sores or warts, or near your penis, your vagina, your mouth, or anus. That is, those orifices used to practice sexual intercourse. Other symptoms could be swelling or severe itching near your penis or vagina, discharge from the penis, vagina discharge that has bad odor, causes irritation, or is a different color or amount than usual, vagina bleeding that is not your period, painful sex, painful urination or frequent urination. Other symptoms that could appear on the body are skin rash, night sweat, jaundice, that is yellowing of the skin and the white of the eye. Also, you could experience weight loss, diarrhea, aches, pains, fevers, and chills. Those are the common symptoms of sexually transmitted infection. Okay. And there are risk factors. Like I said, being sexually active is the number one risk factor. If you're sexually active and you're not sure of the faithfulness of your partner, you are at risk of sexually transmitted infections. Okay. Other risks are unregulated tattoos, getting tattoos in places where the needles are just shared anyhow, they're not sterilized, unregulated piercings, sharing sharps, needles while using intravenous drugs, especially for drug addicts. These are practices that predispose you or expose you to sexually transmitted infections, even if you are not sexually active, and even more when you're sexually active. I hope you understand that. Now, I've mentioned complications of sexually transmitted infections. HIV can lead to AIDS, syphilis can damage organs, nervous system, and even infect a developing fetus. And you could also spread to other people, who will in turn spread to other people, increasing the chain and incidence of the sexually transmitted infections. Okay. Having unprotected sex, okay, either vaginal or anal or even oral sex without wearing a condom is the greatest risk for STIs, okay? So condoms are not just to prevent pregnancy, they are also to prevent sexually transmitted infections, okay? Having sexual contact with many partners, it is ill advised, it is wrong, it predisposes you to sexually transmitted infections. Or having a history of STIs can also predispose you to have other STIs, okay? Because it is much easier for another STI to occur in somebody like that. Then, forced sexual activities like rape, of course, will predispose the victim to sexually transmitted infection. Misuse of alcohol or use of recreational drugs, substance misuse and abuse leads to impaired judgment. You not be able to think straight. You start doing things that are risky when you're supposed to practice safe sex. You just have unprotected sex, sharing and needles, for drugs and all of that would predispose you to sexually transmitted infection. And younger people have high level of STIs compared to those who are older. I guess we know why. Because of the attitude at that age of being free. I want to experiment. I want to live my life. All of that could lead to you contracting sexually transmitted infection, which could have far reaching effects even beyond yourself. So please consider being more careful. Now to the prevention strategies, okay? There are many ways to avoid or lower your risk of getting STIs. Number one is avoid sex, abstain from sexual activities, okay? Abstain from sexual activities. It will save you a lot of struggles, a lot of stress, save you energy and money at the same time, okay? If you cannot abstain, stay with one uninfected partner. Be faithful with one faithful partner. We have to emphasize that faithful partner because you may be faithful while your partner is out there sleeping with everybody and bringing the diseases to you. So stay with one uninfected, faithful partner. Okay. Also, avoid vaginal and anal sex or sexual activities with new partners until you have both been tested for sexually transmitted infection and confirmed to be free. Okay. So, if for any reason you're changing sexual partners, please run the necessary tests to be sure that both of you are clean before you engage in any sexual activity. Also, get vaccinated for the sexually transmitted infections that are caused by some viruses for which vaccines have been developed, like human papilloma virus, hepatitis B. Please get vaccinated so that you can protect yourself. Then use protection, condom, dental dams. Use them consistently and correctly. Like I said, condoms are not just to prevent pregnancy, they help you to prevent STDs. If you have it in your mind that after the two, I'll just go and take one capsule of Ampiclox, I need to bust your bubble and disappoint you that doesn't work. Even if it used to work in the past, which I highly doubt, it doesn't work anymore because, like I said, antimicrobial resistance is a thing now. It is a force. Those things do not work anymore. So please protect yourself. Use condoms, use dental dams if you engage in oral sex, okay? For your own good. Never use an oil-based lubricant such as petroleum jelly with a latex condom or dental dams, okay? Because those ones could predispose you to even exposure. Again, those ones they offer less protection for STDs that involve exposure to genital sores such as HPV or herpes. Please, birth control pills, intrauterine devices do not protect against STIs. Use protection. Do not drink alcohol excessively or use illegal drugs because if you're under the influence of these substances, you are most likely to take sexual risks, which will predispose you to sexually transmitted infections. Please talk to your partner. Be sure that both of you understand each other. Know that you're practicing safe sex before you engage. Okay? Also, use pre exposure prophylaxis, especially for those at risk of HIV infection. There are medicines that can be used to prevent contracting these diseases. So, talk to your healthcare provider about these options. So, those are the preventive strategies for STIs. I hope you're taking note of all of this. You know those symptoms I talked about earlier, if you see any of them, either you are sure or not, either you're sexually active or not, please go see your healthcare provider as soon as possible. There are various tests that can be used to confirm if you have STIs or not. Your healthcare provider will be able to diagnose you either symptomatically or by ordering these tests and they'll give you appropriate treatment. I have mentioned earlier that treatments are majorly antimicrobials, either antibacterials or antivirals or antiparasitics will do the work at the correct doses. Your own duty is to inform your healthcare providers about your symptoms as soon as possible and follow their instructions on taking your medications to the letter. If you're experiencing any side effects, if you're experiencing any recurrence of symptoms, please do not hesitate to inform them again. Okay? So that the incidence of sexually transmitted infections will be reduced to the barest minimum. And that alarming statistics that I reeled out in the beginning will be cut down. Okay? That is it about sexually transmitted infection. And that is what I think you should know at this time about STIs. Please be responsible, sexually responsible for your own good and for the good of people around you, and even for your unborn child as a female, okay? And even as a male as well. Have ruled out the complications causing infertility, ectopic pregnancies, low birth weight, premature birth. A lot of these things they can be avoided if we only do the right thing. Okay? Thank you so much for listening up to this point. You know that as usual, I will still beg you to please subscribe to this podcast, follow, like, leave your reviews, leave your comments, ask your questions, send me mail at antipharmacistpodcast at gmail.com with your comments, with your questions. I'll be sure to reply you. And please, most importantly, share this podcast to as many people as possible that need to hear this, especially young people between that age range of 15 to 49 who are very sexually active. Let them know the risks involved in having indiscriminate, unprotected sex so that they can be more careful to prevent incidences of STIs. Also, there are many other episodes on this podcast that inform you correctly and accurately about your health, about your medications usage. Please take advantage of this, listen to them, share them, support me, please. Follow me on social media, on Facebook, on Instagram as Antipharmacist Podcast, on TikTok, Antipharmacist Podcast as well, on X Fan Podcaster. I have a personal LinkedIn page where I share my health content as well. Bemisola Adebisi Jose. Like I said, engage me via my mail, antipharmacistpodcast at gmail.com. Follow my YouTube page, people. Abi, subscribe. Yes, subscribe to my YouTube page. Help me to grow it. I know I came late to that YouTube thing, but I was having some technical difficulties. Now I have over 80 content there. They are audio for now, but I'll be reeling out video content soon. I want to make it, at least standard for you guys. That is why it's still in the works. Support me, help me to grow that page. You know the thing about growing a page, once more people subscribe, more people share it, it gets to more people. The analytics sees it and makes it visible. Because this information, they are not cheap, oh. They are very, very important. They are very, very important. So help people around you by sharing these things with them. Thank you so much for supporting me. And I am still counting on this support going forward on this podcast. Till next time, stay healthy and God bless you. Bye.